I'm Dr. Mayberry, and I am going to tell you about the hyoid and the sternum. The hyoid looks like this. The main thing that you actually need to do on my lab practicals is be able to know that this is the hyoid. Really the only thing you might be likely to mistake it for is a mandible for an infant, but it is different, and I will show you how. So the hyoid has two sets of horns. These are the greater horns. These are the lesser horns. They are much lesser than the greater horns because you can barely see them. So those are the main landmarks, and then this center area is the body of the hyoid. So it's very thin. It's not much of a body. It's not really like your vertebrae or anything. Your hyoid is actually all the way up there. If you push in there, your voice will change. Your vocal cords attached to the hyoid, but it is a floating bone. It's not articulating directly with any other bones. So if we look back here on Stan and move him, this is his hyoid right in here. So you do have muscles that attach to the hyoid, but it is a floating bone. Okay? All right, so that sums up the hyoid very quickly. So we're also going to do the sternum. So the sternum, lots of people call the sternum their breastbone, but call it your sternum. So this is the sternum right here. It actually has a number of segments. We talked about how the sacrum fuses during life. The sternum does the same thing. So the sternum actually starts as 6 segments, and for most of your adult life, it's usually 3. So this is a sternum. It's missing one segment. It's missing a xiphoid process. So Stan actually has the xiphoid process right here. It's usually kind of sharp. It's at the very bottom of the sternum, and sometimes it never fuses in people, which doesn't, it's not good or bad, it just doesn't fuse. So we are looking at the rest of the sternum here. So this is the manubrium, this very thick superior portion. So up here, this is Stan's manubrium. Okay, so this is the suprasternal or jugular notch, and these are the clavicular notches, which if you look at Stan behind me, you can see that the clavicles rest here, and they're bound in with ligaments. So clavicular notches, suprasternal or jugular notch. The rest of the notches that we're going to see on the sternum are actually costal notches, or costal facets. So costal, again, we're talking about the ribs. So ribs 1 through 7 are actually articulating here. So rib 1, this is costal cartilage in here, but rib 1 is sitting right underneath your clavicle. And remember, you do have a costal impression on the inferior aspect of your clavicle, so that's why. So rib 1 is actually articulating or attaching to the manubrium, and then 2 through 7 are going to attach down here to the rest of the sternal body. So this is the sternal body, or corpus sterni. Corpus means body, and these are those costal notches along the sides. So on some individuals you can actually see that these would have fused during life. This person, they're relatively smooth, you can't really see lines in there. So that is variable as well. You don't have to side this because there's only one, but you should know the difference between the anterior surface and the posterior surface. So it is actually curved a little bit, and there's usually an angle here where the manubrium is sitting. And realize there's cartilage here in life. They're not completely separate. So sternal body. Before these are fused, we actually refer to them as sternebrae, which is similar to vertebrae, but of the sternum. So there's that. Let me make sure I didn't miss anything. I did not. So that sums up our hyoid and our sternum. Okay, so if you have any questions, feel free to ask me in class, and I will see you then.